responsibility of the person with the illness to communicate, this is a symptom, this isn't you. And I am seeing how my irritability as residue from what I went through or what my mental illness is. I see that it affects you, and I'm working on that. And the spouse can ask, hey, I'm sensing some serious hostility on your end, and I don't know that it's warranted on my end. That communication is just so critically important.
In all the good times and even the trials, through tears and through laughter, yeah, I know that I'll smile when I think of you. Smile for the things you do. Smile, God gave me you. You are the reason I smile. Yeah.
This is Behind Our Smiles.
Pursuing connection.
And finding joy.
Even in the struggle.
Welcome back to another episode of the Behind Our Smiles podcast. We are Joe and Tara Buchanan, and as always, we are so glad that you're hanging out with us.
And today is an alternate episode. It is not our usual type, and it's not necessarily a guest of a married couple, but we do have a very special guest that we are so excited to talk to.
Yeah, Dr. Mork, with this month being Mental Health Awareness Month, we thought it would be awesome to have a conversation with her. We have some questions for her. We have some questions that we think you may have as well, and just talk through mental health and how our mental health impacts our marriages.
So we want to talk to the expert, right? I mean, we can't get much more of an expert than Dr. Melissa Mork. She's actually a fellow podcaster who hosts the podcast Mental Health with Dr. Mork, and we will link that in the show notes. A fabulous podcast. But she's also a clinical psychotherapist, professor, a speaker, and an author, and she has some amazing insight to add to this conversation.
Yeah, so again, we asked her some tough questions. Or actually, you did, Tara. You asked her some
that's the catch with this one. I went solo on this one.
I wasn't able to be there for them getting together, but Tara did a phenomenal job, asked Dr. Mork some very tough questions about mental health and marriage, and how do we handle it when a spouse struggles with mental illness.
So again, I was on my own, but I really enjoyed my time with Dr. Melissa Mork.
But Dr. Mork, we are so grateful to have you on the show today. This is a special episode. This is kind of like a mental health break. Take a pause from regular programming. Take a mental health day.
Yes. Thank you for having me, Tara. I really appreciate it.
Thank you so much. And with it being Mental Health Awareness Month, I love that we have an opportunity to talk about these issues because it's real. And when we struggle with mental health, it doesn't happen in a vacuum.
Right.
It often affects our closest relationships. And since here on the Behind Our Smiles podcast, we talk about marriage. I love the idea of having a conversation with you about mental health and how it affects our marriages.
Let's do it.
You're the expert, so you have to have all the answers.
Of course. My husband used to say that. He would say, you have your doctorate in this. Why can't you fix us? And I'd be like, well, I don't know that it works that way. Funny.
So I'm going to dive in with the hard one because this is something that Joe and I have talked about in many different ways over the years. He struggled with mental health from stuff he suffered in his childhood. And when you're struggling with those things, they're not always necessarily easy to live with. There's just stuff that comes out. There's just things that happen that overspill. So sometimes when we were dealing with some of those issues, I knew that he had these things in his past, and I know that he struggled with these things. But I kind of go, when are you having mental health issues? And when are you just being a jerk? Like, I want to give him empathy and say, I know that you're struggling, but I also need accountability in our marriage. So how would you even begin that conversation? Because we still haven't quite landed on a place.
Yeah, no, I haven't either. And that's a great question because it is very confusing. And I'm just going to use my own. So I have PTSD. And when I've been triggered with something and I'm just really working through it, and it is squirting out sideways onto my spouse, it isn't fair to them. And yet I cannot control it. And so the question is, what is he to do? Or what are you to do? And I like to equate mental health to physical health and mental illness to physical illness. Health means you're doing great. You're really working on improving, enhancing. We do exercise and nutrition and good sleep and all those things. And mental health, we're doing things like checking in with ourselves and engaging in good self-care, that kind of thing. Illness, on the other hand, is a terrible inconvenience, and it compromises us. If we think about physical illness, it compromises how we interact with our world. It stops us from doing things that we really wish we could do. It interferes with our ability to move forward sometimes. If I've got a broken leg, it's really hard to hobble around. But when I am physically ill, my spouse has to accommodate for that and not take it personally that I am having an upset stomach or that I'm dealing with a headache, that it's not their problem, that I'm showing symptoms of this illness, and to not take it as an insult, an assault on the relationship, that this is just symptoms of my physical illness. Mental illness, same. The part that is required of both of us in this relationship is that I get an accurate diagnosis, just like if I was struggling with symptoms of renal failure, we would want to know, okay, what are these symptoms that we need to watch out for and make sure that we're doing what we need to do to take care of those. My spouse gives me support, but I'm responsible for my treatment and for medication compliance and doing everything right. Same with mental illness, is that if I can get an accurate diagnosis for my condition, and it is up to me to take responsibility for managing those symptoms, and it is my spouse's responsibility to support me and to love me in the same way that you would if I was experiencing renal failure, that you would say, hey, I'll drive you to dialysis. I will make sure that you're getting the right diet and nutrition. But ultimately, I'm just going to be an observer and a support person in your managing your own symptoms. The point of having an accurate diagnosis, Tara, though, is that then we know what those symptoms are, and that we know, okay, so you're reacting strongly to me asking you to fold the towels is tied to how you were parented as a child, and that's tied to the triggers of that kind of thing. Got it. But when you're snapping at me as we're driving, that's not part of your trauma. That's just you being
Impatient.
highly irritable. Yeah.
Mm-hmm. I think
Right.
the irritability part is a part of it, because you do know when you're struggling with mental illness, there's that cloud and there's a weakness, right? You just don't have that same strength to handle irritation. So that's a good question to go. But then living with somebody who's maybe highly irritable can be difficult for the person, even though you know, like, hey, they're weak. It's like someone who's got a headache or a migraine. You know they can't handle too much stress. But at the same time, you're like, I want to be able to talk and not feel like everything I say is going to cause an explosion.
Right. And again, that goes back to the responsibility of the person with the illness to communicate, this is a symptom. This isn't you. Mm-hmm. This is a symptom. This isn't you. And to take responsibility and say, I am seeing how my irritability as residue from what I went through or what my mental illness is. I see that it affects you and I'm working on that. But also in every relationship, it's healthy to communicate where I'm at. So if I'm having, man, my mood is just so dark right now because of my major depression. My tolerance for any kind of annoyance is really low. It might be wise for you to give me wide berth because I'm not handling life very well right now. But to communicate that to your spouse, and the spouse can ask, hey, I'm sensing some serious hostility on your end, and I don't know that it's warranted on my end. I'm just going to take some space. But that communication is just so critically important.
I think for Joe and me, that he was pretty good about all along kind of saying, I'm struggling. He didn't quite know how to put words to it. And I think he was very good about always saying it's not you,
right? Even
though I didn't always believe it. Over time, I finally began when he was able to say, this event really aggravated me, not you. But it's so hard to receive that because it all feels very personal in marriage.
Of course it does. Yes. Well, and I hate to engender it, but I think sometimes it feels more personal when we are the wife and the caregiver and the caretaker and the emotional manager, and to feel personally responsible for all of the emotional tone of the house when that's not our job and impossible to do. And especially when there's mental illness in the house, whether it's mine or his, I do not have to burden all of the responsibility for the emotional tone from morning to night.
That's hard.
I know it is.
Talking about wanting to fix a spouse who is mentally ill or having just that constant struggle, there are ways we can help, but then we can overhelp. How would you describe helping versus overhelping?
Listen, when you figure that out, Tara, I would really like to know the answer to this. How do I not overhelp? I mean, it goes back to, again, knowing what the actual symptoms are that need treatment and what part is personal, just being a jerk. It goes, I can't fix either of those things, right? I can't fix either. But what I can do is love through both and then set up a personal boundary around my heart as to this is outside of my area of control. And I think this is good for all mental health, not just yours and mine, but every person's mental health, is to look at, really, really look at, what do I have control over in this life? And when you think about it, not a whole lot. You have control over what you can say, how you can behave, how you think, what you eat, where you go. Like, you can control you, and only barely. But can you control the other person? No. Can you control your children? No. You can't control much else except you and your responses. And so when it comes to what might be spewing out at you because of a mental illness, you set a boundary over how much you can control. And part of it is controlling your response to it. How will I respond? How will I respond internally, emotionally, in my own experience, but also how will I respond to the person I love so dearly? And that's a hard boundary to set, but that is the first place to start.
I think that's something that I struggled with for a lot of my marriage, because I knew it was affecting me, and I knew some things I didn't like. And we didn't have fancy diagnosis. We were kind of just winging this. But I wish I had the language to somehow say, hey, I know this is your problem. I know you're the one who's struggling. But I don't think I ever found the language till many, many years later to go, this affects me. This hurts me, or I'm confused. What would be some good language to go your mental health issues affects me, and I need support too? How do you begin that conversation to say, hey, this affects me, even though it's your problem?
I think that's exactly what you say.
It's that simple, huh? Your problem.
Here's the language. The language is not saying you are the problem, you need fixing, but articulated as, this illness feels like it has an agenda to cause harm to our relationship. This problem out here is affecting me in here. And not making it about you, not pointing the fingers and saying you're the problem, but to say this issue it's causing me angst. It's causing me worry. This is how I'm feeling. I'm feeling this way. But you tapped onto something that I think I want to belabor a little bit. And that is, I need help. Not from you, because you're struggling. You've got this illness that's going on here. But as a caregiver, I need help. I'm going to go talk to my own counselor to help me process and learn the best way to support you, to help me understand what my role is here. I think everybody, Tara, should have a therapist. I do. My kids do. I think everyone should. And especially when you are in a relationship with somebody who's really struggling, it's important to have that kind of support.
Well, the other issue we had, because Joe knew that he carried this bag of ugliness, right? This bag of, he wanted to protect me from most of my marriage. I don't want to bother you with some of this stuff because it's ugly and it's not fun and it's too easy and it is my problem. So we did kind of own it from that sense. But you can't wall it up and say, this is my issue. I'm not going to share it with you. So again, there's that healthy way of saying, I need to let you in, but not in a way that said this is your problem. Because for a while there's honey, don't worry about me. I'm just going to hole up in the corner and deal with my stuff and not bother you with it. And I was kind of locked out of the deepest part of them in his attempt to protect me. So have you seen that happen before too with, hey, don't worry about me. You got a great life. Just carry on.
I haven't seen that very much, because that is a skill that not many people have developed, that ability to compartmentalize so deeply that they shut it away from the person.
That was probably a coping mechanism for him.
Probably was, yeah, because most of the time what I'm seeing is that the illness is so unmanaged that it is kind of vomiting out all over the household and everyone in it. But either way, that need for support is there for the caregiver, for the person who loves the individual who is experiencing the illness.
Well, I think to clarify, we experience the effects of that, but not wanting to talk about the root
cause.
Oh, yeah.
Gotcha. Yeah. Because I cannot imagine anyone compartmentalizing it so well that they just come across as a, polished persona. But yeah, all the consequences of that are really difficult. Yeah.
What about if you see these symptoms and you know from knowing your spouse that there's pain and there's mental illness going on, but they don't necessarily want to pursue health? They're not taking that responsibility, or even small steps. How do you kind of encourage them without taking ownership of it?
That's a really hard one. And again, because I equate mental health and physical health, mental illness and physical illness, same, I will tell clients, my students, anyone who will listen, frankly, if you have a mental illness, you have a responsibility to everybody that you love, as well as to yourself. You have a responsibility to get it looked at. If you broke your leg, you would not ask your spouse to carry you around with that broken leg from the bed to the bath to the kitchen to the couch. You wouldn't ask them to carry you because your leg is broken. You definitely wouldn't be hopping around on one leg and making your loved ones watch you suffer. You have a responsibility to put a cast on that thing and then to do physical therapy to strengthen it. Mental illness, same. You have a responsibility to get medical intervention when appropriate and then therapy to strengthen it. It is just a responsibility that you as a grown-up have. You owe it to your family, you owe it to yourself. So with mental illness, I encourage my clients and my students, if you're in a relationship with somebody who is demanding that you carry them around, quote unquote, because of their broken issue, start gently holding them accountable. I am not your crutch. I cannot be your crutch. I am your spouse. I am your sister. I am your friend. I love you too much to watch you suffer. I will help you find help. I will drive you there. I will go with you. Now, if there has been a history of bad treatment, for example, I will have a student who says, yeah, I tried medication and it didn't work. Or I tried therapy and it wasn't a good fit. It just didn't work for me. Well, that's because that was the wrong medication. That was the wrong therapist. And if I broke a leg and I say, yeah, no, I went to the doctor once before and they didn't take care of my bladder infection well. No, you still go back. You still go back and get a cast on that thing. And so we continue to we look for the right, best treatment. We don't just give up on it because it wasn't a good fit the first time. Now, not everybody has that easy of an experience. And I understand that in your own household, there's complications around past treatment and such. But for the most part, I really encourage those who love somebody with a mental illness to hold that boundary well, that I cannot carry you. Once you get a cast on that, when I can help you get your treatment and adequate treatment, then I'm going to bring you a pillow and your blanket and soup and a glass of cold water. And I will bring all of these things. I will give all of my love and support to you as you are recovering. But let me help you recover. That's my role, is I will help you in your path to healing.
That's great. I think part of that process probably involves what we're talking about now, which is mental illness awareness and not spreading that stigma onto them. Because some people look at mental illness as a way to push somebody down and say you're less than. You yourself are flawed, or you yourself are a less worthy person. But to be able to hold your spouse up high as a worthy person, rather than like, you crazy person.
Yes, we would never just wash our hands of the person that we're married to because of their physical symptoms. If they had an autoimmune disorder or diabetes, we wouldn't be like, oh, yeah. Well, you're on your own with that. We would absolutely support them, check in with them, and then not make everything about that illness. Mm-hmm. Yeah, there should be zero stigma around mental illness. It's neurochemical, it's neuroanatomical.
When you have issues of shame washed in the middle of it. That's so much a part of it often to help rise above the shame. You don't need to be ashamed of this, or you don't need to be ashamed of the fact that you're struggling, because that often is the first barrier to getting help.
Yes. So I host a podcast as well. And on one of my most recent episodes, I interview an individual who had harm OCD, where she would have these obsessive thoughts of causing harm to her own children. And just the shame, deep, deep shame about that. She couldn't talk about it to anybody because what would others think? She couldn't even go to the doctor because she was so terrified that if she confessed this, that she would have her children taken away. When she finally went and talked to the psychologist and said, I'm having thoughts about harming my children, he very gently said, you're not the only one. And that alone reduced so much shame in her. But it was such an obstacle to overcome, that shame. Such an obstacle to overcome to even go in and get help. So yes, I think you just nailed it, Tara. Shame precludes us from getting help. And stigma is part of what contributes to that shame. So if we can start these conversations and normalize the experience that we're all somewhere on a spectrum of disorder, physical illness and mental illness, we're all somewhere on that. Nobody is perfectly healthy. Nobody. Because we're living in a fallen world. Sickness is pervasive, physical, mental, same.
So how can we empower ourselves? And maybe this could be for either if we're in a place or we're vulnerable to becoming, having more issues with mental illness, or if our spouse is in a place, staying strong ourselves, because watching someone with this, it can wear you down. And I mentioned earlier about Joe want to protect me. He didn't want to drag me down. He was not, like the image of someone drowning, in order to save themselves, they push someone else's head under the water. He didn't want to do that. He's like, I know that if I grab onto something, I could push you down and I'll harm you in my attempts to get healthy. That can't happen if we're not watching it. But how do we keep ourselves strong in those times we're saying, okay, we can feel that depression, we can feel that cloud, we can feel that negativity kind of suffocating in your home? What would you say for kind of keeping a healthy mental health environment in your marriage? Yeah.
As the one with the illness, or the one who's...
Maybe as a supporter first. And that could be a whole other episode, but the prevention's element, like, there's stuff happening and you almost feel, even on a spiritual attack side, right? You can kind of feel it closing in, and you start to go, I'm feeling hopeless as a caregiver.
Oh,
like for you, Melissa, like if you are working with patients all day long, that's a heavy burden to carry, because when you're dealing with that kind of darkness, it can put a toll on you.
I'm going to answer in that context first. In that context where I feel that I am giving a lot of support, I am carrying a lot of the burden for the people that I'm caring for in the clinic. Or even when my husband was dying of cancer and I was his caregiver, I found that I was desperately in need of a couple of things. One, checking in with myself throughout the day. How am I doing? Like setting a timer even, and just, how am I doing right now? Doing a little bit of journaling, a little bit of prayer. But what I have had to do in every role of giving care to others is that I know that as a person of faith, that I can take each person and lay them down at the foot of the cross and take a deep breath and then step away, because I cannot fix. Ultimately, I am only a conduit of care. I am not the savior. I can't be. So if I can lay them down at the foot of the cross, that gives me a little bit of freedom. That gives me some healthy emotional, psychological, even spiritual boundary. But journaling has been my saving grace, prayer, and the ability to not carry that burden on my own shoulders, because it's not mine. I'm not their savior.
You mentioned earlier, too, that element of support for yourself, whatever that looks like, so you don't feel alone.
Well, yeah, Tara, I'm a mental health expert, right? Apparently, that's what people call me. And yet I have to have my own therapist, because I need clarity. I need to be able to check in with myself. I need objective, I have all of the resources. I have all of the resources that I use in therapy for my clients, but I don't have the objectivity to be able to apply them in my own life. I need somebody to facilitate that process, to remind me, remember, this is what you're dealing with, and this is the tool that you can use to manage that. Oh, that's right. And I forgot about that. So we all need some help in gaining clarity, in developing boundaries, in helping us be the support and the loving person in that other person's life that we want to be. Yes, getting help is critically important.
That sounds a little bit like that self-care too.
Yes.
Making sure our own hearts are protected. And there's that breathing room just to take that deep breath. I like that. And even if the answer, when we take a deep breath, is, I'm not okay, well, you have an answer now.
Right. For May is Mental Health Awareness Month. I've been really focusing on strategies for really good mental health. And one is checking in with yourself, just exactly what we've been talking about. And the second is connecting with other people and getting the support we need outside of that relationship, for example. And the third is connecting with God and connecting with nature. If things are intense in the house, taking a break, stepping away, going outside, going for a walk, breathing in the fresh air, doing all of those things. And then the fourth is connecting with resources and getting help for your own support. So those 4 things are so important for all of us, no matter what our condition or our loved one's condition.
Thank you so much, Melissa. This has been such a very, very helpful conversation. I know it's just the tip of the iceberg because none of these things come easy, but just starting the conversation is sometimes part of it, and finding those words to use. I think sometimes we know in our head what we're thinking, or we have a feeling, but we don't have the words to say, this is hard, or are you okay? Am I okay? To start the conversation is a great first step to those issues in your marriage that might be, causing disconnection and causing struggle.
And that one question, I think, is a powerful question to ask you and your loved one. And the question is, how am I doing right now? How are you doing right now? And just that checking in routinely throughout the day can be, instead of it becoming so catastrophic and overwhelming of how am I doing, but how am I doing right now? Right now I'm feeling this. And you can Google things like the emotion wheel to get a better emotional vocabulary to say, I'm feeling a little angsty right now, or I'm feeling blue and also heavy. It gives you the language. So just that checking in is so important.
To hear both spouses share those things is massive.
Massive. What a great place to start.
You can't diagnose the problem until you know what's happening. That's what you mentioned earlier.
Indeed.
Thank you so much for your time, Dr. Mork. This has been a great conversation. You have a podcast as well. You cover all the diagnoses, pretty much. So many different stories. I like how there are similar diagnoses, but always a different story. And there's something to relate to in every story that you share. And even the treatment might be similar, but unique to that person. And you kind of see the whole plethora of how recovery might look. And that's what we're all about, is hope. And just to say, hey, someone else has walked the path you've walked, and there is hope on the other side.
Absolutely. And my whole reason for starting the podcast was to start to dispel the stigma of mental illness, especially in the church, among people of faith who may feel that their illness is a result of sin or a lack of repentance, and finally coming to realize that this is just illness, and that finding health and recovery actually enhances our spiritual health and our relationship with the Lord. And so I just want to reduce the stigma around mental illness.
That shame we talked about that keeps us from sharing, it keeps us from intimacy with each other sometimes, but it also keeps us from going to God. We feel like, again, inherently as we are we are bad people or something's wrong with us. And to open up that relationship with God then allows everything else to begin to heal as well. A great way to end is to remove that shame and that stigma so we can live in the community and the intimacy with others that we were designed to have.
Yes.
Preach, Tara. Thank you so much. And we will hopefully have a chance to talk to you again soon.
Thanks so much. Bye-bye.
Behind Our Smiles is a Wow God production, a ministry of the University of Northwestern St. Paul. Discover more at wowgod.com.